Well, good afternoon, everyone. The city of Richmond in general and the local government are in phase 3 of Fort Virginia and our operating procedures. If you have any questions about city services, you can access and visit our website at richmondgov.com/COVID-19. And if you're unclear how Fort Virginia affects small businesses, the small businesses you own or you may patronize, please visit rvastrong.org/reopening guidance. Okay, as of this morning, the City of Richmond's Health District, the Richmond City Health District, is reporting 3,662 confirmed positive cases over time in the City of Richmond. 43 Richmond residents have unfortunately lost their life to COVID-19, the novel coronavirus. And as usual, I'd like to take a moment for a moment of silence. Thank you. Now, I'm well aware that many Richmonders are returning to their jobs, they're returning to class, all these in person, but this does not mean that the virus is gone. It has not disappeared. It is still with us. Some 5 to 6 months into this, the virus is still amongst us, and I ask that we still be vigilant and be careful, continue to adhere to the CDC guidelines and protocols, watch your distance, wash your hands, and wear a face covering. This is now, I think, a perfect opportunity for every resident, whether you're a student or just any everyday resident here at the City of Richmond, to download the COVID-Wise app if you haven't already. I've done it. Dr. Avula's done it. Everybody here has done it. We ask that you download that, whether it's in your app store, whether it's in you on an iPhone or a Samsung, you name it, please download that app. And if you get a notification of exposure, then there are plenty of testing options for you in our community. This week, those testing options are Thursday, August 27th, we'll be at Tuckahoe Middle School from 9 a.m. to 11 a.m. On Wednesday, there will be a community testing site at Broad Rock Community Center from 9 to 11 a.m. as well. And on Thursday, September 3rd, there will be another opportunity to test over at Tuckahoe Middle School from 9 a.m. to 11 a.m. Remember, these testing events are available to the broad public, regardless of your insurance status, your citizen status, your mobility, or geographic location. And if it would make you or your family more comfortable to know about your status, we ask that you attend one of these testing events in our community. And if you're ever unsure of your testing options that are available to you, we ask that you continue to visit rvastrong.org/testing or call the RCHD hotline 804-205-3501. That number again, 804-205-3501. I'd also like to take the opportunity to remind everyone that masks are still mandatory. I don't know why I have to repeat myself some 5 or 6 months in, but I think it's worth saying it again and reiterating the fact that masks, if you're entering any public space, are still mandatory. Entering a business, still mandatory. And in your office, still mandatory. And you know what? We still wear them outside as well. I just left an event outside that was socially distanced at the Virginia History and Culture Museum, and everyone was wearing a mask, even outside. Please, please wear your face covering. I also want to say that our mask network is expanding as well. You know, the City of Richmond is providing free masks to all those who need it and all those who want it. If you represent a church, a nonprofit, neighborhood association, or other community space and want to join our mask network, visit rva311.com and easily search for the word mask. With that, I'm going to have Dr. Avula come and provide some details on our public health status as a community. Dr. Avula.
Thank you, Mayor Stoney, and good afternoon, everybody. As we've started kind of publicly reporting on the new pandemic metric dashboard that the State Health Department has created, our central region continues to be in the status of a high burden of disease with fluctuating trends and therefore substantial community transmission. So the same place that we were in last week, we continue to see at different places in the region increasing trends of disease. Here in Richmond, we have had an increasing case rate for the past 10 days. Not significant spikes, but just a steady increase in that case rate. On the other side of that coin, we have seen decreases in percent positivity. So for the last 17 days, we've had steady decreases in the overall percentage of people who are tested that actually test positive. Our current 7-day rolling average for percent positivity is 3.8%. And then we've also seen an increase in the rate of outbreaks or clusters that we are investigating. We, on a daily basis, are responding to positive cases, and then if there are other contacts that are identified that test positive, we count that as a cluster investigation. This past week, our greatest number of clusters were seen in manufacturing settings, warehouses, restaurants, and bars. And so, along with the mayor, I'd continue to urge people to remember that COVID is still out there. We need to socially distance and wear our masks if we really are going to keep this at bay. I also appreciate his reminder of the community testing events. What we have seen over the last month is that there's been a general decrease in the total number of people who are coming out to get tested. Through the course of the pandemic, we're regularly seeing 200 to 300 residents show up at each testing event. We're about half that right now. So if you are concerned that you've been exposed, if you are showing any symptoms of COVID-19, I would really encourage you to call that hotline 205-3501 and come out and get tested. And lastly, I just want to thank our Medical Reserve Corps. We have had an amazing response over the course of the pandemic from volunteers across the city who have wanted to engage in this work with us. Our roles are about 1,200 strong in terms of volunteers. I was at a testing event yesterday, and more than half of the people staffing that event were Medical Reserve Corps volunteers. So thank you to everybody who has responded to that call and been willing to come out and participate in the comprehensive COVID response for our city.
Thank you, Dr. Avula. So last week, I asked Richmond families to fill out the survey at this link right here, bit.ly/RVA family, to tell us their child care needs for this upcoming fall. And as of this morning, we have about 1,900 responses. Results have come from Family Zone for schools all around the city, and 7.5% of responses were given in Spanish, reflecting our city's roughly 6% Latino population. This week, the community ambassadors will continue distributing flyers promoting the survey in our RRHA communities. So far, 70% of respondents have been unable to find child care arrangements for some or all of their children. And it's clear there's a need, but we'll continue to determine how best to meet that need. And if you have a child in the city of Richmond, I request that you take this survey. And please tell us what this fall is looking like for you and your family, so we can design a solution that fits you. So, moving on, I also want to talk a little about the city's continual contributions to ensuring that our small businesses are thriving. Our small businesses and nonprofits have been the beating heart of the Richmond community. And they've been the beating heart even through this challenging time. Their resiliency and service have reminded us what being a city is all about. And that's why I am proud today to launch the Richmond Recovers Grant. This Richmond Recovers Grant program will give grants between $10,000 and $15,000 to nonprofits and businesses to reimburse employee wages, pay rent and utilities for commercial spaces and use as working capital. The program is funded with $3 million allocation from the CARES Act dollars that the city has received. The city has stepped in to provide vital relief to the Richmond Disaster Relief Fund in the earlier stage of the pandemic, but this virus effects are still ongoing. So support should be ongoing as well. So with this funding, the city will have allocated over $4.1 million to support small businesses during this health crisis. So I'm continually grateful for the work of the Department of Economic Development led by Leonard Sledge. Mr. Sledge is here to answer any questions if there are any. They have been responsible with working alongside the Richmond Economic Development Authority in administering this program. So remember, that is the Richmond Recovers Grant, now available to small businesses and nonprofits here in the city of Richmond who are in need of relief through these most uncertain times. And with that, we will take some questions. Oh, I'm sorry, Superintendent Cameras, do you have anything? One thing.
Thank you, Mayor. Very briefly, first, I just wanted to say welcome back to all of our teachers who started today for their pre-service in preparation for the 2020-21 school year. Had the chance to virtually welcome them all this morning, and we are incredibly thrilled by their enthusiasm, creativity, passion, and optimism for this year. And I just want to say on behalf of RPS, thank you. We are deeply, deeply grateful to our teachers and our staff all across the division. I did want to note that starting Monday, August 31st, so next Monday, we will be running our new fall meal distribution schedule at hundreds of bus stops all across the city. Kids will go to the bus stop, and instead of getting on the bus, they'll pick up a breakfast and lunch for the day. That will be running every morning, Monday through Friday, from 7 a.m. to 9 a.m. All of the details, including all of the stops and the times for each stop, are on our website, rvaschools.net. And you just click on the heart icon where it says Reopen with Love, which is the name of our reopening plan. Thank you all very, very much.
Thank you, Mr. Cameras. And now we will take some questions.
Yes, a question for Dr. Rula.
Yep.
With the numbers that we've seen recently, obviously VCU is dealing with a situation on campus right there. Is it accurate for us to say that the numbers we've seen increase here in the city could be linked to the outbreak there at the school?
Sure. The question is the increase in cases that we're seeing in Richmond City reflective of the activity we're seeing at VCU? That is certainly a part of it. I mean, VCU has been very transparent about publicly posting the number of cases that they have in terms of their students and faculty on campus, and that is contributing to the overall case rate. It's not the only thing driving our case rate right now. As I said, you may have seen the announcement recently by the city jail that they're dealing with an active outbreak as well, and then we're seeing clusters pretty consistently in restaurants, bars, and then this week, for whatever reason that we're still trying to determine, manufacturing sites and warehouses were really increased as well.
As these students return to their campuses, outside of VCU, what's your recommendation for these students? Because based on the VDH website, it looks like the age range from 20 to 29 is really the leading age range in terms of positive cases since March.
Yeah, it absolutely is. So I'll just kind of repeat the statement is that the 20 to 29 age group has really been leading the case count. That has been true over the last couple of months. We've seen a surge in that young adult population. I think it is to some degree reflective of phase 3 reopening, young adults feeling like they're not vulnerable, and so they're out and about returning to some sense of normal activity. And so what would my advice be? It would be that we've got to recognize that your behaviors do not only impact yourself. And so what we've seen in these initial outbreaks on campus is that, young adults are coming back. They're excited about seeing each other. They're hanging out together, and that's leading to the spread of disease. And while most young adults will fare just fine, the reality is that this disease spreads without us even knowing it. And so the contact, the incidental contact, whether it's in a classroom setting with a professor or with somebody who might have an underlying condition at the grocery store, those are the scenarios we really need to think about to ensure that we're not putting others at risk.
Yeah, I was wondering, regarding childcare, with 1,900 families filling out a survey, 70% of families being unable to find childcare to go to cameras or to Mayor Stoney. I'm wondering, is this a matter that the school board will need to vote on, and if so, it's a matter that the school board will need to vote on, and does that fall into your recommendation on what the school board might need to do as far as opening schools for childcare?
So I think the question was, given the roughly 1,900 responses, 70% saying that they do not yet have childcare, what is the implication of that for the school board and the use of RPS facilities? Did I got it right? Okay.
Your recommendation based on
Yep. So I haven't had a chance to look at all the data yet, but I'm looking forward to doing that. The school board will meet on Monday to discuss this. Once I've had a chance to look at all the data and confer with the board, I'll prepare a recommendation for our meeting on Monday. I know the board cares very deeply about making sure all of our young people have access to childcare. These are all the same kids and the same families, and so I know they are weighing that very, very seriously. And I appreciate the mayor's effort and his putting CARES dollars on the table to help make this happen. So I am confident we are going to come to a great collaborative agreement that will make sure that we take care of all of our kids in Richmond.
And Mayor Stoney, should the school board decide not to reopen their school buildings for childcare, where do you think the city could provide childcare if not the schools?
The question was, if the school board chose not to open any facilities for this sort of emergency childcare effort, would the city, what else would be offered for this? What we've heard from around the city, there are a number of different organizations, and with these organizations with their facilities would obviously be helpful, but the most helpful in this process would obviously be a school facility. They already have desks, they are big facilities, and obviously we believe that we can find a resolution between both RPS and also between city government on bringing that solution to the fore. I'm optimistic that we can do something together. I want, obviously, for the school board and Mr. Cameras to be able to review the data and make a sound decision, and when they do, we stand ready to work alongside them to ensure our kids get the best.
Are you good? Karina, you good?
Well, I guess this, Mayor Stoney, this might be for you. How many businesses are we talking could potentially receive the funding from the CARES Act? I don't know if there's a set number that you all would be allowed to get.
We're going to have Leonard Sledge come and answer that question about, was there a set number of businesses that will receive the dollars for the recovery grant?
Good afternoon. If I heard you correctly, it's how many businesses will be eligible to receive funding. As Mayor Stoney mentioned, we have $3 million allocated for the Richmond Recovers Grant Program, and the way the funds will be granted will be based on the number of employees on a tiered basis. And so grants ranging from, again, $10,000, the middle tier is $12,500, and the upper tier is $15,000. And so we're prepared to make grants until we expend the funds.
Is there a deadline for when people can apply?
That's a very good question. So the question is there a deadline? The grant guidelines will be posted immediately today. The application will be an online portal. People will be able to apply starting on September the 1st, and we will be receiving applications through September the 30th. If for whatever reason we do not expend all of the funds during that time period, or from applications received during that time period, then we will commiserate and discuss putting out a second call.
Are there any certain qualifications that a business might need to meet in order to get this grant money?
So the question is the qualifications or the eligibility. Everything will be posted on rvastrong.org, but for just a few brief criteria, businesses cannot have more than $5 million in revenue in 2019, no more than 50 employees that are W-2 wage earners, or full-time rather, no more than 50 full-time employees. And again, all of the guidelines for the program are posted at rvastrong.org/Richmond Recovers.
Thank you very much, guys. Appreciate it.
Thank you, guys. Be safe and strong. Take care.